One of the common treatment decisions, unfortunately, that we see in caring for people with advanced dementia, and advanced dementia are diseases like Alzheimer's disease, vascular dementia, frontal lobe dementias, is what to do when somebody stops eating or drinking. Or more typically, people don't actually just stop eating or drinking. They slow down, and they have difficulty eating and drinking. The easy solution, or let me rephrase that. What may seem to be the correct solution is to surgically implant a tube, or what we say endoscopically implant it into the stomach, and provide artificial nutrition and hydration through a tube to prolong life and make swallowing easier and reduce the risk of aspiration, that is, having stomach contents come up and go down into the lungs and causing pneumonia. And that would be a very simple solution. But as Mencken has said, for every problem there's a simple, straightforward solution that's wrong. So what's wrong with tube feeding? A number of things. First of all, although we don't have what we call science randomized controlled trials, we have a preponderance or a very large amount of evidence to suggest that tube feeding doesn't prolong survival in end-stage dementia. People don't live longer. Well, how can that be? We're providing them with nutrition. Well, there's a couple of reasons for that. The first is that, as I said, people really don't just stop eating and drinking, and that with very careful and meticulous spoon feeding, you can provide enough nutrition and fluids by careful spoon feeding that somebody will continue to live for as long as the disease progresses. So that's a myth. The second is that tube feeding doesn't reduce the risk of aspiration, that is, stomach contents going into the lungs. What causes a problem, or what causes aspiration pneumonia, is not food going into the lungs. It's all the bacteria in our mouth and in our upper airway that we swallow that goes down into the lungs, which is a sterile place. And so the worst pneumonias don't happen because somebody aspirates their food. It's because they aspirate their saliva and their secretions. Tube feeding doesn't change that. What are the harms of tube feeding? There's a number of harms of tube feeding. The first is that one of the great pleasures in life is eating and drinking. People like to eat. You put a tube in a person with dementia, that is gone forever. They don't eat or drink. And that simple pleasure is taken away from them. We have very good data that shows that tube feeding is associated with an increased use of restraints in people with dementia. That is, we tie people down so that they can't pull out the tube. We did that in the old days. Now what we do is we give them medicine so that they don't pull out their tubes. And I would argue that that's not good quality of life for people with dementia. And then finally, one of the questions that I always ask the relatives of people with dementia, I ask my patients with early stage dementia, and I ask my patients in an advanced care planning discussion, is tell me about what to you would be a fate worse than death. That you would rather die than be kept alive in that state. And for most, not all, but most, when they say, I can't recognize my family or friends, I can't take care of myself, that would be a state in which I would not consider life to be worth living. That would not be an acceptable quality of life. Tube feeding, overwhelmingly for somebody with dementia, happens after that point in time. So for most people, what I'm doing is providing a treatment that is maintaining a quality of life that they would find unacceptable. And I can, in good conscience as a physician, recommend that. There's a small number of my patients who would say life is precious no matter what, and that I would like you to use every measure to keep me alive as long as my heart's beating. For that small group of people, tube feeding may be appropriate. But for most of my patients, it doesn't meet their goals, and therefore I wouldn't want to use it.